want to make this video, I still do not know. But I have said in many of these pictures that I have uploaded, eat good, stay strong, and keep active. I often said, don't let your disabilities affect your abilities. I have rheumatoid arthritis. That's one of the problems I suffer. And as a result, it is a destructive illness, but thanks to the Lord, I am not suffering as I once did. I am not cured. I will not be cured except by a miracle from Him. Humans don't know how to cure it. Rheumatoid arthritis is basically a problem with the immune system where it becomes hyperactive and it attacks the joints, the connective tissue and the muscle, and in severe cases, believe it or not, it still can kill, even though there are many great medicines to help. Some that are less harmful on the body but will still take their toll, including steroids for treating the inflammation that is chronic, immunosuppressant drugs like salizapyrin, sulfasalazine, or hydroxychloroquine, or there's a few more. I just don't remember them all at the moment. There is also the next step up, which is the strong cytotoxins, which is a chemical that naturally occurs in the body. And it is an anti-cancerous chemical. It's an agent that attacks cancerous cells in the body. That is why when you use it in a high dose, it is often used to treat as a chemotherapy for hormone cancers. But in low doses, that same chemotherapy is used to bring the immune system down to very minimum activity. That is safe, of course, or as safe as can be at least. There are extreme side effects when you have to put a needle in your arm or in your stomach or in your backside or your leg once a week. It's never going to be nice. And when I had to do it, believe it or not, I don't like needles. But for me, it was more better having the old-fashioned syringe where you can see the needle go in than the new pens where you have to put it on your skin, you press the button and it just slams in. I don't like that. I always did it as a doctor would take a blood test at an angle, subcutaneous. And when I've had to do B12 injections because I couldn't get appointments with doctors, I would just do the same. It would go in at an angle, but it would go in deeper towards the muscle because they're intramuscular. However, it is a cytotoxin, so it promotes the growth of these agents in the body that kill cancers, and they lessen arthritis and psoriatic arthritis too, which is arthritis related to psoriasis. And I want to say, it does still kill rheumatoid arthritis, not as much as it used to. You no longer see people with their hands all mangled up like they used to because of the advancements in medications and the new line biological agents, which are even stronger than the chemotherapy agents in many aspects, with more dangerous side effects, I would say. And the reason why we would use a chemotherapy agent or a biological agent in rheumatology is because a patient has not responded to the more kinder treatments, or because if rheumatoid arthritis is the case, they may have, if they've had a history of cardiomyopathy, which is enlarged heart, tachycardia, if they've had a history of left ventricular hypertrophy, then it could be possible that the person is suffering rheumatic fever. And what that is a issue where the immune system, instead of just attacking and seeing parts of the body like the joints and the connective tissue as foreign invaders and doing its job against them, which it does against cold and viruses and things like, and bugs and bacteria every single day, but it will see your heart wall, the wall of the heart, as the exact same. And when that comes under attack and under stress, cardiomyopathy, enlarged heart, tachycardia, elevated heart rate, that could be dangerous and lead to things like ventricular tachycardia, which kills, or left ventricular hypertrophy, which could cause ST elevation, which could lead you to having a cardio malfraction, which is a heart attack. Rheumatoid arthritis is very comorbid. It is still a dangerous illness, even though you could be walking past a sufferer every day and you would not know it, because the advancements of medicine mean they can still walk about, move around like normal. It just means first thing in the morning it's going to be painful and stiff for them. It can be painful throughout days at time on end. So I have rheumatoid arthritis. And I think I wanted to talk about that because of the medication aspect, the methotrexate. Because I was watching something about homeopathic treatments, and yes, I said every one of these individually is proven to work, and when you put them together, it can work even more effective. Just take one capsule a day. I said there are other things like soursop leaf, which you would have to take 10 grams in a tea twice in 24 hours, then go a couple of days without. If you've got a thyroid issue, take it every 3 days or twice a week, because it promotes the growth of cytotoxic agents in the body. Now, I'm not suggesting people take any medicine or ask for any medication. I'm not endorsing no medication. But I understand if people need to take a medication. Rheumatoid arthritis is serious, and it still affects millions upon millions worldwide. And I have only got the grace of God that I am able to do what I'm able to do now, when before I would not have been able to do one iota of what I can do now. I shouldn't be lifting weights the way I can, but I do. Especially because I've also got degenerative disc disease in the spine. And sacroiliitis, which is swelling up of the sacrum joint in the lower spine, or as they call it, the tailbone, the coccyx, and this region here. But I'm able to do so much, which I shouldn't be able to do. And I take no medications for this anymore, or for any other health problem I have. I may take an asthma pump every now and then because I still get bad coughing, and I have something called cough variant asthma. So my main symptom is not tightening of the chest, wheezing, and that is going into a coughing spasm and a coughing fit. So I just want to say you should have trust in yourself, have trust in God. If you say you trust God and you love God and you believe in God, then get to know God. Because how he performed miracles when he was on earth with his ministry of 3 years, 4 months, he can still perform miracles now. I know he can. So stay strong, keep active, and eat healthy. Remember, food is the first medicine. And you are not alone. Your suffering is not in silence. Keep going.